Up a disposition on it. It was very that did it.
And aren't you glad you're pretty good at running?
I don't feel pretty good, but thanks for saying that.
Well, you haven't gotten anybody slapping you yet.
No, I have not had that.
Of course, you haven't been handling women yet.
Yeah,
Great.
well, they say behind every successful man is two.
Well, it's my shirt.
It's
more than that.
Six tonight. 4, 5, 6, 7.
Okay, it is 6 o'clock. Let's call the meeting to order. The Subcommittee of the Pine Valley. Mary, you want to do a roll call?
Sure.
That Mary. Mary's all over the place.
Mark Gills,
Here.
Mary Miller,
Here.
Pat Ripshin,
Here.
Sandra Kramer,
Here,
Mark Cooey, Gary Manning.
Okay, we have a quorum, so that's what's important. And can I get a motion to approve the agenda?
I'll make that motion to approve the agenda.
Second.
Okay, great. Sandy and Pat. And all in favor, say aye.
Aye.
Any opposed? Okay, moving on. Okay, was this posted? Was it verified or posted? Yes, okay. And then approval of the minutes. Has anybody seen any corrections, additions?
I read Joe Marinsky.
All good?
I'll make the motion. Yes.
Okay, and Mary's making a motion to approve the minutes. I think we don't even need the motion, we get to say, with no corrections or additions, we'll just approve them as they are. And public comment. Anyone from the public want to comment, either here or online? Is there anybody online? No. So that limits some of that comment, so great.
Well, I have one thing. Donkeys will be on the move.
Yes,
soon.
I'm excited. I think I was.
Whether the dog is coming.
Well,
This is
probably their
important.
first outing will be Memorial Day. But I did receive a call today from Sauk County Healthcare Center. She wants to do it in May. I have to call her back and tell us I gotta wait for my Coggins test to come back before I can take them off property. So, and the vet's not coming out to do that until May 2nd. Takes about 2 weeks for that to come back.
Okay,
So, but they will be on the move right after Memorial Day, for sure.
What is the test for?
Coggins test, it's like a, I don't know, it's not an airborne virus, but they can get it from each other. Like I suppose through sneezing or whatever. And, there's no cure for it. So if they catch it, they will die. So it is the Wisconsin state law that you have, if you take an equine animal, mule, donkey, horse, and you're gonna be in amongst other horses, that you have a Coggins test done. And, yeah, they will die from it, so mine are all checked.
is that an annual test that you have to do?
Yes, it is. Yep, yearly test.
Okay, well, we've learned about Coggins testing.
Yeah.
What'd you say?
It's Coggins testing.
You will never need one.
Okay. Sound like an expert on it.
Sorry.
Okay. Okay, let's move on to our Pine Valley Census recap.
So for the month of March, we had an average census of 66. We were budgeted for 64. For our CVRF, we were budgeted for 14.75 and averaged about 15. And currently we are at 67 because we had an admission today.
Okay, so I think we're ready for the financials. Mary, you want to give us an update?
So in the packet is, you'll find the balance sheet and statement of operations for the month of March. So that's agenda item 7A, 7B. And I apologize, we have to do some rotating here. 7B, you'll see the accounts receivable, and we've had the accounts receivable days in revenue is 39.5. Again, as a reminder, our target is to be below 40.
Below 40, you said?
below 40.
So we just made it.
Do the anti-rotate. Agenda item 7C is the cash flow. This depicts our receipts and expenses. So the receipts for March were $930,465.73, with expenses totaling $2,089,255.50. In March, we had the adjustment to our workman's comp insurance premium, and that was $3,062, as well as the semi-annual debt service and related interest payments, which totaled $1,269,087. Moving on to agenda item 7D. These are our vouchers for the month of March, and they are being presented for your approval for payment. So I would like to review a couple of these vouchers with you. I would like to start with check 210, and that is written in the amount of $11,043.33. And that is for our credit card bill. And so I can review some of the charges with you. There was $279.39, and that was to Pizza Hut. And that was for the Super Bowl party for our residents. $390 was to Walmart, and that was for 2 laundry baskets for each resident room. $3,325. And again, I'm reviewing the credit card statement. You won't find these on the voucher listing. $3,325. That was to the Healthcare Institute. And that was for CNA courses for 5 staff, so that was $665 per course, per staff. $1,642.83 was for purchases made through Amazon, and that was for bookcases, file cabinet, a desk, storage cabinet, and dry erase board for the HR office. $125 charge for leading age, and that was for the MDS facility registration renewal. $242.96 was to LG Parts, and that was for dryer belts for, I believe it was 3 dryers in the resident halls. $455 for AHT backup. And then we have $2,235.28, and that was to Cape Cod Brass, and that was for push button code locks for internal doors to replace those that were worn out or no longer working. $815.04 was to Amazon, and that was for a food processor. That was a replacement of a damaged food processor. And $414.69 was for window tint, and that was for south-facing offices, for south-facing windows in the offices. Now back to the voucher listing. Check number 250 in the amount of $438.38 was for Rhine Business Products, and that was for copier services. Any questions on the vouchers? Elaine?
Can I ask?
Yes, you can.
I was just curious what would cause mileage reimbursement?
They go for continued education courses. So I have CEUs that I'm required to go to. So I'm required to travel. So our DON goes to them for her continued education to stay up to date on state and federal regulations, as well as our MDS coordinators. So typically for them.
It's nice they do that. I didn't know that. Oh, thank you.
Can I ask too, I thought we were getting rid of the nursing staff that was coming in, but it seems like there's like $26,000 here.
Unfortunately, with the current wages we are sitting at, we are not receiving applications.
Are we gonna talk about that in the administrative report? That'll be coming up. There you go.
We can talk about that.
Any other questions?
I was just gonna mention that the one nurse did leave to the nearby healthcare facility for $41 and something an hour. And that's something we can't compete with.
No.
I just think we all need to be aware of that. So we need to make the work environment more pleasant, so they stay.
The work environment's fantastic. I will say that. We obviously have to hold our staff at a higher standard due to obviously the survey that we had gone through. However, we are well below, based off of my research to other county homes, we are significantly below even what they're currently offering at this time. So yes, they can go to a local hospital. LPNs can make, our RNs can be making 37.10 is what Angie and I looked up for one of the local hospitals. And I think we're offering 32 for an RN. So
We just did this whole big wage study, so it's just,
Yeah,
it's a little
we're not-
disappointing to hear that we're struggling, losing people because of wage again.
yeah, and Trish and I actually spoke about that and hope that we're gonna pull some of the job descriptions and review them, because it was all based off of job descriptions. And so our RN and our LPNs, I went in and added a bunch of stuff that was missing off of them. So hopefully with all that additional information that was missing, it might put them up into a higher bracket, because they did technically, with that wage study, they went from 20, LPN started at 26 down to 25. So hopefully that will aid in that process of being able to reevaluate the wages.
Yeah, because we have our consultant that that is doing this, and we need that update and upgrade as much as possible. So we're not losing people to other places because of finance.
Do these other places take into account the benefit package from here?
So our benefits are great, to a certain extent. So when you're looking at health insurance, depending on where you doctor, will depend on how much you pay in a premium. So it really depends on where people live. Plus you have to look at an automatic 6% for retirement. So, I was talking to the staff and they essentially made a comment that says, yes, the benefits are great, but they don't pay my bills. So,
Well, they don't, but I mean, it is being paid for something,
Yeah, they don't have to pay.
but they don't have to.
correct.
I mean,
Unfortunately,
that was always really important to me when I worked. I had a good benefit package, sometimes it wasn't the money.
yeah,
Yeah,
and
yeah.
for me, that's how it is for me. But, you've got single moms, you've got people who are living on a single income. So that additional money is important. So if you can make $45 as an RN and pay $400 a month in premiums and health insurance, it's not as good. A lot of places only, put in 1 to 2% for retirement, if any. But they're making more. With all that overtime and everything that they're making, they can bring home a significant paycheck at every pay period because of the overtime availability.
Is, in your looking around, Schmitz and Muscadet, do they have a benefit package for retirement? They do.
Not anywhere near what we have,
No.
but they offer, I think Riverdale, I want to say 4% match, if I'm not mistaken. And then I'm not 100% sure on Schmidt, but I can reach out to their DON and find
Yeah.
out.
Okay.
What happened here is it was longevity, because this nurse has been in Pine Valley, like, she's a really wonderful longevity employee. And the longevity is where we're dropping the ball, I think. So we really need to recognize this person has been here this long versus somebody that just walked through the door. And that's why you're having the survey issues as well, because we don't have the longevity experience with some of these concerns that were in the survey. So-
Correct.
And that's, we.
That's why I came to Pine Valley, because of that longevity.
What we need to do is work on that.
So we're improving staff morale. When I first came in, April 2nd, it was April 2nd, we did a taco bar. So we're trying to do something monthly for birthdays, anniversaries, and we're doing the employee of the month. So we're starting those processes again, because I think it is extremely important to maintain a positive work environment. With the survey that we just had, obviously there's some more stress that's in the building. And we'll explain more of that process, in the administrator report. I don't wanna pull from the financials, but I'll be more than happy to go over everything with you guys.
Great, thanks. Any other questions about that? We've got final, what's it, 7E area, the aging report. What the heck?
Mark, may I ask for you looking for a motion for approval of the vouchers?
Sure. Can we get a motion for approval? I'll make that motion. Pat can second it. Great. And all in favor, say aye.
Aye.
Any opposed? Perfect.
Moving on to agenda item 7E, this is the aging report. And these numbers are through March 31st. So, any questions?
So line 3, I had talked to the billing specialist. We are billing them incorrectly, so that will be billed tomorrow, and we should be able to correct that $7,601 and get that paid to us.
Okay.
And then as well, I'm gonna touch base with my contact in Medicaid on line 11 and see if I can't get that one cleared up as well.
And then line 16 is cleared up. That was just required an additional journal entry.
Okay.
Can you just explain for my benefit what this report is showing?
Sure.
Thank
So this is the aging report and it shows accounts that are over 90 days past due and over 120 days past due. In the final column, or the column furthest to the right, it has notes regarding the status of the collection efforts. And then it indicates in yellow those accounts that have liens filed properly. We had been reporting these previously when Teresa was here. They were being reported, I believe, on a quarterly basis. We kind of got off track and I made the promise that we'd report on quarterly. And now it's Brittany's preference that we report on these monthly. So this is something, an agenda item that you will see.
And we've written some of them off at times, right? Some of the things that we just sort of ate them at times, right?
In January, we did, right,
A number of.
yeah. Mhm. Wait, excuse me, I believe that was February, when we were looking at January's aging.
Okay. Any questions on the aging report? Okay, then we'll move to the administrative report. Brittany, want to give us the latest?
Yeah, so staffing updates, we talked about that. Currently for nursing, nurses, AM shift, we need 2 full-time positions and then an additional 5 shifts a month. So kind of like your PRN part-time for that third piece. PM shift, we need 2 full-time nurses and then 4 shifts a month, which would again be that PRN. Knock shift, we are actually pretty good on, which we only need 4 shifts a month. So I think it's like an every other weekend need for the knock shift. For CNA's day shift, we need 2 full-time and 1 part-time. We just sent a bunch of the staff and they had graduated and they're working on their testing. So we are kind of pushing them into that position, not in a bad way. PM shift, we need 3, and then knock shift, we need 1. We have another class that'll be coming up, so we will probably be sending some of our RAs to that course and try to be able to fill those. So the great thing about CNAs and med techs, we can grow our own. We have another med tech course that is coming up that we will be sending as well. So hopefully we can accommodate some of the nursing shifts with those med techs. My plan is to attempt to do on the PM shift because the need is much more. We just hired a full-time LPN for days, so that should take some of that off. My hope for PMs is to maybe attempt to do 4 med techs with 2 nurses, which will dwindle down the need of nursing staff, where we have med techs that are passing meds and nurses that can be nurses. So the problem that we had with our survey won't be an issue. The nurses can be nurses, the med techs can pass that meds, We could probably save money in the process because we're not gonna have a bunch of nurses. We will have med techs instead. So kind of like you're seeing, that have that certificate. So hopefully, depending on what happens with the wages, kind of where we'll see where we're at. Dietary, all we need is every other weekend and on call as needed. And then housekeeping, we only have a part-time position. Like I said, we've received a few RA applications. So we are going to transition them between dietary and housekeeping. We're gonna cross-train. That is my goal moving forward. So when we have call-in staff on either one of those, we already have cross-trained staff members to fill in those needs. So that's on staffing. Do you guys have questions on that?
I guess we're struggling to hire new people. And so is everybody struggling or is it
Yes.
just, it's just a tough
It's
market?
a struggle. I think the biggest competition right now is hospitals. You work 3 shifts and then you work every 3rd weekend. So you have that work-life balance. We do 8-hour shifts, hospitals do 12. So, I mean, that's, some people get right out of school and that's where they want to go. We are going to the job fair in, I think it's Fenimore at Southwest Tech, specifically for nursing staff. So we can see what they're looking for, and see if we can't figure out how to get people. Benefits are a great opportunity for us to sell on the building. It's just that wage difference. So, Trish and I are working on that. We had a nice long conversation, today. So she got orientated to our day.
Well, what a great way to start.
Yeah, first day. Why not? Resident activities, so we had coffee last Friday and we just kind of went over the activities. It's part of my new coffee plan, which you guys are all received. Just kind of go over all the departments so we can figure out what's going on, see if we can't make anything more fun. But out of activities that are coming up, we have the token hunt. We have been receiving donations already for prizes. We have the barbecue chicken. They are going to the German warehouse in April. They have a fishing trip scheduled for June or July, and then they have a petting zoo trip scheduled for June or July. They'll flip-flop those. They have an apple orchard trip scheduled for September or October, and then they've been taking the bus and sightseeing with residents. So they just went over the Lone Rock Bridge the other day, the new one that was just built. So they're going to be seeing Plain, Boaz, Muscadet, Lee Lake, Rotary Lights, and Yuba is the plan for that.
Yuba.
Yeah.
What are they gonna do in Yuba?
Yeah.
Trade you or something like that or?
Oh, turn.
I know we'll check.
It's like it's a movie.
It's 2 bars, 3 bars. I have a question before you move on too much. I never remember anyone asking us if we wanted to go with MedTechs.
So MedTechs, they're a great opportunity to, especially with the staffing shortages, we can utilize them per state and federal regulations. They have a very limited scope of practice. So literally all they can do is pass meds, check out the meds and that's it. Nurses have to do PRN medications. They can do injectables, but it has to be a pen, they can't draw. So there's a lot of limitations of what they can't do, but it alleviates that need for the nurse to, they can't do assessments. So we're really reining back on the scope of practice at the building at this time.
So that's why, all the scope of practice and all that is why the nurses don't have to pass meds?
So assessments, and we'll get to that part. So that's part of my SOD. So I can actually jump to that, and then I'll do the emergency drill stuff after. So back on March 17th, a week and a half after I came into the building, state came in under 6 complaints. One of them was change of condition, and we have 2 resident examples per our SOD. That came in as a citation of an IJ. Are you guys familiar what an IJ is?
No.
Okay, it's called immediate jeopardy. So it comes with a significant fine. And then there's a daily fine for the immediacy. So the immediacy started as of January of 2025. And if you read it here, it'll kind of give you examples. So essentially what happened was we had two residents within a couple days of each other have a significant change in condition, meaning it was a change from their baseline, enough that they were sent out to the emergency room. During the first time of initially finding the change in condition, they waited several hours in between doing a second assessment. Onwards up to 21 hours is what the SOD said. Additionally, when they sent our residents out those two times, instead of calling an ambulance, they transport them via taxi. So that resulted in an immediate jeopardy because something could have occurred. It's not something that did occur or somebody did something immediately wrong, but the implications of what could have happened if we didn't, by not doing what we should have been doing.
Some protocol listed somewhere that requires or says we need to, when a person's going to the ER, we need to call an ambulance.
There is now.
But there was not one.
Yes. When I had learned, that we were transporting via taxi, I changed the transportation policy immediately. Under no condition should anybody with a change of condition from their baseline should ever be sent out via cab. I don't care if people feel that they are stable in their change of condition, it's just not appropriate. So I did also have a conversation with Mike EMT to ensure that he was aware that when we send them out, we have doctor orders to send them out, they need to go out. So he is aware and has informed his staff as well to ensure that we are getting them to the hospital with staff that are supposed to be taking them.
Appropriately, okay.
The second citation that we received that day was due to, and this is a very small site, and I don't, if I'm not mistaken, this one does not come with a monetary penalty. It is at a D level. It was for Social Services Department when they did self-reports. The one that they looked at did not have staff education and other resident interviews. So when we do a self-report, we are required to interview other residents, which I created a form for social services to use moving forward for both staff and residents. And it basically asks them the same question. So a resident says they're missing items. We need to interview other residents throughout the building and say, hey, have you been missing any items? If you are missing items, who do you report it to? Those sorts of things. Same thing with staff members. It's asking, hey, what types of abuse are there? What do you do if such and such happens? Who do you report it to and how quickly do you need to report it to? And then providing that education of what those types of abuse are. So it's just missing those pieces. So we corrected that. We're in compliance with that one. We did a desk review that's done. They came back in for an extended survey on March 31st. They gave 2 additional sites in the HR department. We had one staff member whose CNA license was expired. Which she had already fixed that day. It was just when state was there, she did not get it fixed. And then the other one was the annual performance evaluations for nursing staff. So the correction to that is A, we corrected that licensure, and B, now we have audits starting to ensure that we maintain licensure. And then the second one for that is we did everybody's annual, including dietary, anybody who's been there over a year. We just did everybody's annuals and corrected that citation. We are also in compliance with that one already. Those were in compliance the day we received the citation. So those are now both in compliance. So what that means now is state's gonna come back into the building and clear us of the J. I've already got rid of the I, now they gotta get rid of the J. So that's what we're waiting on. They can come in anytime. I put us in compliance as of the 18th, which would have been Friday. So it gives us any additional time to provide additional education should we need it.
How big was our fine?
That is going to depend on their return. So they tend to wait until we've completed and cleared all and back in compliance. They are significant. Because you have the immediacy, a daily immediacy, and that goes all the way back to January, all the way till March when I removed it. So there's a daily fine plus that J. So we will receive something in the mail that tells us we have 30 days to pay, or 30 to 45 days to pay it, and it'll tell us exactly how much it is. But it is not cheap,
Are we talking hundreds or thousands?
thousands.
Oh, yikes.
So,
Go ahead, Ellie.
so whose responsibility was it to make sure like the CNAs were, getting their reviews? Because I was reading, 3 out of, they did review every certificate or whatever, but whose responsibility is that to make sure those reviews are done?
So when I talked to the staff members, involved, which was the DO and the HR, I was informed that what they had done in the past, which is no longer going to be a thing, is they would hand it off to the supervisors, and the supervisors apparently put it in a piece of paper and had them review it, and then expected them to sign it and give it back. So there was a disconnect in the process. And so they weren't getting them back. So they were giving them out on time, but they just never got back or followed up. So the new requirement for the new policy is that the managers or supervisors of that individual needs to sit down, review it, which they should be doing anyways, to give that feedback, the expectation moving forward, and any goals or education that they want them to learn, and making sure that we're providing that, because that's what we're stating. So that is the new process.
It sounds like there's some protocols that have been missing, basically. And I wonder if there's more that we're going to find as time goes on.
Yeah, and I've corrected quite a few of them.
Okay.
The care planning, care conferences, that has been changed and updated, and the requirement has been made to the staff members. They have been following the requirements, because it is a state and federal. So that has been adjusted, and then we're reviewing the fall protocol, and making sure we're in compliance with that.
Oh, super, thanks.
You have been busy.
I have been.
Now, on your falls, does that include patients who have fallen out of bed?
Yeah, so every time somebody is lower to the floor or they're found on the floor, we assume automatically it's a fall. So what we do in the process of a fall investigation is why is it happening? What is it a specific time? We find the root cause of it, we intervene immediately, and then we send them off to therapy for review to see if there's something, is it a weakness, or is it an altered mental state, whatever the case may be. And then we determine additional interventions, whether that be therapy needs. So do they need to continue with therapy after the evaluation, or was that a kind of a fluke thing? They were just kind of feeling off. So our responsibility is to investigate and determine, so we can prevent falls in the future and put preventative measures in place.
So you don't take them anywhere to check for concussions or?
That would be a fall with significant injury. So in order to get them off the floor, the RN has to assess, to verify the resident A, if they hit their head, they go into a neuro check. B, if they're complaining of significant pain, we will send them out. If at any point during the neuro check, anything is off, we'll send them out. If, we document the fall and later on that night, they're in extreme pain, we'll send them out. So we do a full workup after a fall. We have an incident form that we utilize and verify that we've done everything, MD updated, family updated, and just kind of those sorts of things. Care plan gets updated.
I was just wondering.
Yeah.
My dad was there and they found him on the floor underneath his bed the next morning. And I went to pick him up that day for to come home and visit us. And nobody said a word to me. All they said to me was, "Oh, we found your dad on the floor this morning." And it's like, well, did you check him out? And I never did get an answer.
Yeah.
I wasn't happy with that.
Understandably. Typically, so if a patient is cognitively intact,
Mhm.
we ask the patient if they wanted us to notify family. So we don't automatically do it. unless they're activated. So their POA has to be activated for us to just bypass the resident.
Well, Dad was kind of not
Yeah.
there, so, but yeah, they said he looked pretty comfortable underneath his bed on the floor. And I'm thinking, how long was he there
Yeah.
Yeah.
before somebody discovered him? But yeah,
That's
I
unfortunate.
How
was not
common are,
happy and I voiced my opinion.
sure, how common are falls? I mean, you know, like,
We're dealing with so many different types of patients. Our falls have gone down. I guess it really depends. Is there infection happening? Is there, an altered mental status? Are they weak? Are, other factors, medication issues, interactions? They can be common depending on the situation, mental status, things like that, but not too bad.
okay. Very good. Did you have a question, Elaine?
Yeah, so I had a question, because back when Pat and I worked, we had at least 20 residents on our groups. And like, we did a 24-hour report. And so when I'm reading this, it's hard for me to understand, how did it go 20 some hours with people not doing vitals on a new admission? And what, you know what I'm saying? How come they're not, there should be a way that people are
Yeah.
being accountable for what are they doing? It's confusing to me.
Absolutely. So
What's
we've
happening?
re-educated the staff on the use of the 24-hour report, updated our policy and procedure with that. Mind you, we've had about a bazillion staffing meetings regarding the change in condition, the expectation, what we're seeing, and any adjustments that we want made or need made to satisfy the state and federal regulation along with the plan of correction. So in this plan of correction, you'll see on the F684, you'll see the most writing, because that is that IJ. So we put a base plan in, and then as we go, we can continue to add things to this. We don't adjust it here, we just adjust it personally in the facility to what is working, what is not working, and then making those adjustments. So we are kind of on an overkill with things to make sure that we remain within compliance. Staff are accepting of it. It was hard for, that transition over, just kind of understanding the regs that follow behind and why the RN's required to do a lot more because the scope of the practice. But I think the more meetings we've had and let them have that conversation, know the why behind why we're doing this, that we're not crazy, just implementing a bunch of stuff has really helped. So we've actually seen great charting, and the changes in the charting has been fantastic.
Can I ask one more question and then I'll be quiet? I want to know, in relation between the LPN, the RN, or the nursing assistants, where do these med techs come in pay?
Just slightly above the CNAs.
So they're not, what, $17 an hour, so?
I have to look at the pay scale. I don't
Okay.
have it in front of me.
I was just curious.
But they're just above the CNAs, because essentially they're taking on extra responsibility by passing meds, having to do their triple check on the medications and still help out with the CNAs as they can. But they're not allowed to assess. They're not allowed to do any of those things. The LPNs are allowed to gather data. But they essentially all have to report to the RN that's on the floor.
That's always been the case.
Yep, and sometimes, so we have nurse techs, which is pretty much med techs that are currently in school, and they have a little bit more range, but we've kind of pulled that range right now to just straight Medicaid techs, because we don't want them doing anything outside their scope at this time. So we've pulled the nurse tech policy until we feel confident in the staffing that we have.
Okay, thank you. Yes. I'm quiet.
Any other questions?
I always just ask mine privately, sometimes I don't. Yeah,
And then just the last thing that I want to touch base on, we actually had Mike out the other day. We did some code blues, got nursing staff more confident in kind of the emergency behind it, the expectations. It was a little slow moving at first, but the sense of urgency kind of got better throughout the day. We've done our fire drills, we're in compliance with those, and then we did an elopement drill. And we realized, we don't have an overhead paging system, so emergencies, we don't know about. I can't hear the fire drill, so when we're pulling the alarm, I can't hear it back in the offices, them going off. So we are working with MIS because I think our phones have a paging option. But currently, right now, we don't. It's more of a home-like environment, but it's not suitable for when emergencies occur. So we'll be looking into that, but hopefully we'll be able to fix that with the phones.
That's surprising, but that's such a great facility that has somehow that desk or whatever.
They didn't
Yeah.
like the overhead paging in the old building. They chose to get rid of it and not incorporate it.
Correct,
They
and
thought it was disturbing the residents.
they were misusing it.
Yeah,
Is my
uh,
understanding is they were paging overhead for phone calls and things like that, when the only time we should be paging, because it is supposed to be a home-like environment, is when there's an emergency. We've created, code words, so instead of people saying, hey, fire, we're saying code red. So that it's not terrifying the patients or the family members that are in there, but our staff know. We've created these code word badges that all the staff will be wearing so that they know what kind of codes we have going on. We sat with, the fire chief about active shooters, kind of went over that stuff. So we are developing a policy with that and then having them come out and we'll do tour with them and then create a plan should anything occur.
So where do you go for a tornado? Where do you take? I mean, do they just?
Anywhere there's
the
no
Wednesday
windows.
You guys don't hear the Wednesday drill they do weekly then? It doesn't, like.
We
under
can
the
hear those
panel?
drills, yes. We just can't hear like when we pull our fire alarm, we can't hear that. So I have a walkie-talkie that I forget to turn on every day. Until Chad comes in and tries to do a test with me. But we can't overhead page. We can't say, hey, code red, 200 wing, and I can't hear code green, meet here. Chad had to come to my office when we did the drill and said, hey, we're missing a patient. I forgot I scheduled the elopement drill, so I thought we were really missing a patient. So, yeah, so that's a little bit of an issue, to get everybody on board with those, and to get everybody's sense of urgency going, and then the knowledge base to page overhead as we need them. So I will let you guys know what MIS says, because apparently our phones have the capability. I just don't know if we paid for that or not.
So the residents, they're not really involved with the active shooter, their drill or anything like that. It's just staff is, okay.
Correct. So we just kind of get our staff prepared for what it would look like. How are we going to respond? And what kind of, how we envision it. And there's always gonna be continuous drills. There's always gonna be modifications. So we just, all these drills that we're doing is just preparing the staff for in the event of an emergency. Because we could have a fire endpoint, we could have a resident escape, and we could have an active shooter. So we just wanna make sure that our staff are prepared, they know what to do with the residents, and that way we can make sure our residents are as safe as possible.
That's just a sad reality.
Unfortunately, with society these days.
Yeah. I guess my last question would be about the water system. Any update on
Yes.
what's going on with that?
So I told Chad I wanted to meet our new water engineer. I believe he is coming out in the next week or two, so I can kind of get a project idea, and that would come with the plans apparently. So I did ask for that
Okay.
a couple of weeks ago.
And we did finance, it was like $15,000 for a study for 3 different approaches to remedy that issue, so.
Correct.
We are still working on that. Okay.
Yes, so I did touch base with Chad about that, so he did reach out to him and
Great.
said that we should be anticipating a visit from him soon.
Super. Any other questions for Brittany? Okay, hearing none, I think we're ready to get a motion to adjourn.
I'll make a motion to adjourn.
Sanity.
You're all very. Okay,
I can take
okay, a second. Motion, all in favor, say aye.
Aye.
Aye, any opposed? Thanks, everybody.
Yeah.
Thank you.
That's a lot of, POC